All right, welcome to our AT Talk series for 2023. I'm Tracy Strading, Director of the Michigan Assistive Technology Loan Funds, and I'm happy to introduce Sarah Healey. Sarah is an advocate with Disability Rights Michigan. She's worked with the disability community for over 25 years. Sarah's worked as a recipient rights advisor for community mental health, as a support coordinator with the ARC in Massachusetts. Sarah has been an advocate at Disability Rights Michigan since 2016. Her career there includes previous work on the Rep Payee team, as well as information and referral. Sarah earned her bachelor's degree from Grand Valley State University, and she resides in the Grand Rapids area with her husband. So I'm very excited to introduce to you the topic of AT and insurance, self-advocacy tips, and my friend and wonderful advocate, Sarah Healey. Thanks.
Thank you, Tracy. Is this when I should share the screen?
Yes.
Okay, bear with me here. Did that work? Okay,
Yes.
I have it. So good morning, and thank you for having me. Today I'll be talking about assistive technology and health insurance, and I'll be providing you with some basic advocacy tips. My hope is that this information will empower you and lead to more successful outcomes for those who are trying to access AT and AT services through their health insurance. I'd like to start off by talking a little bit about Disability Rights Michigan. As mentioned, I've worked for DRM for just over 7 years. I'm really proud to be a part of the work that we do here. Our mission at DRM is empowering all to uphold the rights of people with disabilities. Let me tell you a little bit more about Disability Rights Michigan. We are the independent, private, nonprofit, nonpartisan protection and advocacy organization. We're authorized by federal and state law to advocate and protect for the legal rights of people with disabilities in Michigan. We are Michigan's federally designated protection and advocacy agency. There's a protection and advocacy agency organization in every state and territory in the country. We are funded by 9 federally mandated programs, state and private donors. We serve the entire state of Michigan, and we receive over 4,000 calls per year to our information and referral department. Let's talk a little bit about our information and referral department. The goal of our information referral advocates is to answer your questions about disability-related issues involving civil rights, special education, employment, AT, abuse, neglect, and much, much more. And not only do we provide information and non-legal advice, but we also provide our clients with referrals to service providers, governmental agencies, civil rights groups, and attorneys. If your issue falls within one of our current focus areas, a manager will determine whether we should investigate or provide some sort of direct advocacy or litigation to assist you. Although we are a legal organization, much of our direct advocacy can be performed by our trained non-attorney advocates. Our services are free of charge and completely confidential. So it all starts with INR. So one of the topics we receive a lot of calls about is assistive technology and related AT services. We hear things like, my insurance denied my request for AT, I don't know what to do next, or my AT needs repairs and I don't know if my insurance will cover it. Or I have Medicaid and Medicare, which one will help pay for my AT and AT services? Well, today I'm going to address these issues and also provide some general information about accessing AT and AT services through health insurance. I'm going to have a special focus on Medicare and Medicaid. Also, we can't talk about insurance without talking about insurance denials. So I'll discuss some of the most common reasons for insurance denials and offer a few tips on filing appeals. Okay, so every good AT webinar begins with a definition of AT. So the Assistive Technology Act 2004 defines AT as any item, piece of equipment or product system, whether acquired commercially, modified, customized, that is used to increase, maintain, or improve functional capabilities of individuals with disabilities. AT devices include things like wheelchairs, hearing aids, speech generating devices, magnifiers, ramps, things like that. Assistive technology services, it's any service that directly assists an individual with a disability in the selection, acquisition, or use of an assistive technology device. AT services include things like evaluations for a device, such as getting a physical therapy evaluation for a wheelchair, or adaptation of a device, training in the use of a device, like if you had to get speech therapy to learn the use of a new communication device, and maintenance and repairs of a device. Today, you'll hear me talk about both AT devices and AT services. So who pays for AT and AT services? I mean, we hear that talked about a lot. I mean, it depends on the type of AT and how it's used and the user. Some types of AT might be really simple and inexpensive and you can purchase yourself, while others might be very expensive. So some of the major funders for AT and AT services would be private health insurances, government programs such as Medicaid, Medicare, school systems, rehab and voc programs, employers, the VA possibly. Today, I'm going to focus on Medicare and Medicaid, and I'll talk briefly about health insurance. But I'd like to mention that I'm not a Medicare, Medicaid expert, and most of the information I'll be presenting today can be found on Medicare.gov, the MDHH website, and in the Michigan Medicaid Provider Manual. And I'll provide you with website addresses for those at the end of this. Okay, so what is Medicare? Let's start here. Medicare is a government-funded health insurance for persons age 65 and older, persons receiving Social Security disability payments or railroad retirement payments based on a disability, and persons with end-stage renal disease. So there's three major parts to Medicare, and then there's a fourth part. And I'm going to go over each of them real quick here. So Medicare Part A, also known as hospital insurance, that typically covers inpatient hospital stays or care in a skilled nursing facility sometimes, hospice care, and some home health care. Keep in mind, if you're in a skilled nursing facility or a hospital inpatient, AT would be covered under Part A. And then there's Medicare Part B, also known as medical insurance. So Part B covers certain doctor visits, outpatient care, medical supplies, and preventative services. Medicare Part B is typically what covers AT and the various AT services. And then there's Medicare Part D, and this helps covers the cost of prescription drugs, including many recommended shots and vaccines. You notice I kind of skipped over Part C. Well, Part C isn't actually a Medicare plan. It's a Medicare Advantage plan. So Medicare, it provides Medicare approved plan from a private company that offers an alternative to original Medicare for your health insurance, for your health and drug coverage. So these bundled plans, these Medicare Advantage plans, they typically include Part A, Part B, and usually Part D as well. They may offer some extra benefits that original Medicare doesn't cover, like vision, hearing, dental services. Medicare Advantage plans have yearly contracts with Medicare. And one thing to keep in mind is that if you're on a Medicare Advantage plan, it must follow original Medicare's coverage rules. Okay. So what types of AT does Medicare cover? Well, Medicare covers certain medically necessary AT under its benefit for durable medical equipment, DME. You're going to hear me use that a lot today. So DME is a type of AT. Examples of DME include wheelchairs, walkers, hospital beds, scooters, portable oxygen equipment, speech generating devices, and the list goes on. Under the DME benefit, it also includes prosthetics, orthotics supplies. And this is also under Medicare Part B. So prosthetic devices that replace or part of an internal bodily organ. Prosthetics, this is like artificial legs, arms, eyes. Orthotics, this would be rigid or semi-rigid leg, arm, back, and neck braces, and certain medical supplies. Medicare covers certain prescription medication supplies that you use with your AT, even if they're disposable and can be used only once. For example, Medicare covers medications used with nebulizers. Medicare also covers the lancets and the test strips that are used with diabetes self-testing equipment. So what are some of the Medicare requirements to get your AT covered? Well, first we'll start off with medical necessity. So Medicare says the AT must be necessary to improve, maintain, or prevent deterioration of the individual's medical condition. The individual must have a medical condition that requires the use of the AT. It must be prescribed by a healthcare provider, must be prescribed by a physician or other healthcare provider who is treating the individual's medical condition. So it might be your doctor, your physical therapist, they're all going to be a part of this. The AT must be used in the home. That's a biggie for Medicare. So the AT must be used in the individual's home or another place of residence that serves as their home. A hospital or nursing home that's providing you with Medicare covered care can't qualify as your home. However, a long-term care facility can qualify as your home. But if you're living in a long-term care facility as part of a stay covered under Medicare Part A, the facility is responsible for providing the DME you need while you're in the facility for up to 100 days. And DME must meet Medicare's definition of DME. That means the AT must meet Medicare's definition of durable medical equipment. And that's defined by the equipment must be durable and can withstand repeated use. It's used for a medical reason, not usually useful for someone who isn't sick or injured. It's used in the home and generally has an expected lifetime of at least 3 years. So then also it should be purchased from a Medicare approved supplier. Oops, making sure I'm on the right place here. That's enrolled in Medicare and meets all of the Medicare requirements. Depending on the equipment or the AT needed, you might need to rent or buy it from the approved supplier. So covered under Medicaid, that's another requirement. Makes sense. The specific AT must be covered under Medicare. It's important to note that not all AT is covered by Medicare, and there might be limits on the amount of coverage for a specific item. Additionally, Medicare coverage may vary depending on the individual's specific Medicare plan. Let's go over the general steps for getting AT paid for by Medicare. First, you're going to want to get a prescription from your healthcare provider. This would be the first step in getting AT paid for, is to obtain that prescription from your healthcare provider. The prescription specify the type of AT you need, as well as the duration and the frequency of use. You might also need documentation to support your need for AT. This would include things like evaluations, medical records, treatment plans, etc. And next, you're going to choose a Medicare approved supplier. Medicare requires that you purchase or rent your AT from a Medicare approved supplier. You can search a list of approved suppliers on Medicare's website or by contacting Medicare directly. You want to make sure that you choose a supplier that carries the type of AT you need and they're approved by Medicare. And then next, you're going to wait for Medicare to process the claim. After the supplier submits the claim, Medicare will process it and determine whether the AT is covered under your plan. This can take several weeks, and you might need to be kind of patient for this one. And then finally, pay any cost not covered by Medicare. Medicare approves the claim. They will pay for a portion of the cost of the AT. You may be responsible for paying the remaining portion. This could include co-payments or deductibles, depending on your specific plan. Like I said, some of the Medicare Advantage plans, they're going to have different co-pays and deductibles. Be sure to ask your supplier and Medicare about any costs might be responsible for. You might want to know that upfront. So And I also want to talk briefly about prior authorization because Medicare requires prior authorization for certain types of AT before they'll pay for them. This is to ensure the device is medically necessary and appropriate for the patient's needs. Some examples of things that might need prior authorization would be power wheelchairs and scooters, speech generating devices. These are devices that help people with speech impairments be able to communicate. Internal nutrition equipment, which includes feeding pumps and related supplies, CPAP machines and respiratory assist devices, external infusion pumps, which are used to deliver medication or other fluids into the body. If you're unsure of whether a specific type of AT requires prior authorization from Medicare, it's always a good idea to contact Medicare directly or speak with your healthcare provider or supplier. They would likely know as well. Finally, on Medicare, if you want more information about what I've talked about and learn more about the specific guidelines for each type of AT that it covers, you can contact and visit Medicare.gov or 1-800-Medicare and get your information. Any questions on this section of the presentation?
I don't have any right now. I would like to just put out there that MAPS counselors, Medicare and Medicaid Assistance Program counselors are available across the state of Michigan and are a great resource, especially as you're trying to choose the plans you use. So I hope you don't mind me just injecting in there that that's a great place to start when you're planning to get AT, even down when you know that down the road that will happen. A Medicare Medicaid Assistance Program counselor can help you sort out which might be best for you.
Oh, I agree completely, Tracy. I'm actually going to be speaking with a MAP counselor next week, trying to figure out my mom's Medicaid and Medicare plans.
It's a great resource. Yeah.
Yep.
So I just want to throw it in there. So, but I don't have anything yet in the chat or the questions yet.
Okay. All right, well, moving on then. So now we're going to talk about Medicaid. So Medicaid provides health coverage to eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by the state according to federal requirements. The program is funded jointly by states and the federal government. Medicaid is considered the payer of last resort for AT. I mean, this means that if you have other insurance or sources of funding for AT, such as Medicare or private insurance, those sources must be exhausted before Medicaid will provide coverage. So, for example, if you're enrolled in Medicare, Medicare may be the primary payer for certain types of AT. However, if your Medicare coverage is not sufficient to cover the full cost of the equipment, Medicaid may provide coverage for the remaining costs as a secondary payer. Medicaid may also cover the copays or deductibles required by your primary insurance. In Michigan, several Medicaid plans and waiver programs may cover AT and the AT services that are medically necessary for eligible individuals. This isn't a complete list of all the plans, but I just wanted to point out a few of them. So there's traditional Medicaid, also known as fee-for-service Medicaid, or you might hear it as straight Medicaid. This provides coverage for people of all ages with low income. There's a Healthy Michigan plan. This provides coverage for low-income adults 19 to 64 with incomes at or below 133% of the federal poverty level. We have My Child, we have Children's Special Health Care Services, and then a couple of waiver programs that I tend to know a little more about than some of these other things would be the Home and Community-Based Waiver Program. This allows eligible individuals who need assistance with activities of daily living, but who wish to remain in their own homes and communities instead of receiving care in a nursing facility. And then there's a My Choice waiver, similar to the HAB waiver, the Home and Community-Based Waiver. It's for individuals who wish to remain in their own home and still receive the care that they need. So, like I said, this isn't a complete list of all the Medicaid waiver program plans and waiver programs. So you might want to go onto the MDHH website and you can see a full complete list. Okay, so Medicaid and AT. So Medicaid will typically cover the cost of certain types of AT, including, as we talked about with Medicare, durable medical equipment. This includes things like wheelchairs, walkers, hospital beds, oxygen equipment, things like that, things that are used for a medical purpose. Prosthetic devices, orthotics, so we covered both of those in previous slides, and communication devices. These are devices that are used to help people with speech or hearing impairments communicate, such as hearing aids, speech-generating devices, and augmentative and alternative communication devices. And then diabetes supplies. This includes things like insulin pumps, glucose monitors, other supplies that are needed to manage diabetes. And I just want to note here that some of the Medicaid waiver programs may offer coverage for additional AT devices. So this isn't an all-inclusive list. So Medicaid requirements. The next two slides are going to be my wordiest slides of this whole presentation because I copied and pasted them directly out of the Michigan Medicaid Provider Manual. I think that's really important for these two is because medical necessity is an issue. And one of the reasons for a lot of appeals is something that is insurance will determine that item is not medically necessary. So I want to go over how Medicaid requirements define medical necessity. So I'm going to read through this, so bear with me. The service or device meets applicable federal and state laws, rules, regulations, and MDHHS promulgate, I have hated that word, policies. It is medically appropriate and necessary to treat a specific medical diagnosis, medical condition, or functional need, and it's an integral part of the nursing facility daily plan of care or is required for the community residential setting. The safety and effectiveness of the product for age-appropriate treatment has been substantiated by current evidence-based national, state, and peer-reviewed medical guidelines. The function of the service or device meets accepted medical standards, practices, and guidelines related to type, frequency, and duration of treatment, and is within the scope of current medical practice. All right, one more of these slides. Almost through them all. This is a lot for requirements for medical necessity. So also, it is inappropriate to use a non-medical item. It is the most cost-effective treatment available. The service or device is ordered by the treating physician, NP or PA, and clinical documentation from the medical record supports the medical necessity for the request and substantiates the practitioner's order. The service or device meets the standards of coverage published by MDHHS, and it meets the definition of durable medical equipment as defined in the program overview section of this chapter. And finally, it meets FDA and manufacturer indications. Now, like I said, I didn't go through these two slides to bore the heck out of you or to confuse you, but if your AT is denied by Medicaid, it very well could be for one of the reasons listed on these last two slides. So I think it's important to know just how many requirements there are to get your AT under Medicaid. So what are some of the steps to getting AT paid for by Medicare? Well, it's very similar to Medicare, maybe a few little differences, but the general steps to accessing AT through Medicaid may vary depending on the specific program and the type of AT or device that is needed. I mean, first, you're going to want to obtain a prescription or referral. To get Medicaid to cover AT, you'll need a prescription or referral from a healthcare provider. This might include your physician, physical therapist, occupational therapist, or other healthcare professional. You're going to want to obtain the necessary documentation to support the need or the medical necessity of the AT. This would include evaluations, assessments, medical records, that type of thing. And next, you'll want to submit a request for authorization. Depending on the type of AT or device or service, you may need to submit this prior authorization to Medicaid. This could be done by your healthcare provider or by the supplier of the AT device or service. And then next, you're going to wait for approval. After submitting the request for authorization, you'll need to wait for Medicaid to review and approve the request. It could take several weeks or longer, depending on the complexity of the request and the specific Medicaid program that you're in. And then finally, you're going to obtain that AT device or service. Once the request for authorization is approved, you can obtain the AT device or service from a Medicaid-approved supplier or provider. Medicaid will typically pay for the full cost of the AT device or service, although there may be very small copay depending on your Medicaid plan or program. So I want to talk a little bit about repairs and replacement parts under Medicare. So if Medicaid paid for your AT, they will pay for the repairs and replacement of parts covered by Medicaid. So all conditions of the warranty must be followed prior to requesting any repairs or replacement parts. Routine periodic servicing, such as cleaning, testing, regulating, and checking of equipment is also covered. And then if equipment is found to be defective or not operating properly, the supplier must remove it from service. It cannot place it into service again until it's brought up to the manufacturer's operating standards. And it's the responsibility of the provider, the person repairing your AT, to supply loaner equipment while the equipment is being serviced. And Medicaid may consider replacement of the equipment when it's more costly to repair than to replace. And then Medicaid did not pay for your AT. They may still cover repairs and replacement of parts, but it would only be under the following conditions. If the AT is, once again, medically necessary, meets the standard of coverage, and includes the required supporting documentation. And also, if you're dual eligible for Medicare and Medicaid, and need AT devices or services, both programs may pay for a portion of the cost. So in general, if the AT device or service is covered by both Medicare and Medicaid, Medicare will pay first and Medicaid will pay second. This is known as Medicare-Medicaid coordination of benefits. Medicaid may cover the cost-sharing amounts that Medicare doesn't cover, such as deductibles and copays. So if you're dual eligible and need AT and devices or services, it's a good idea to consult with your Medicare and Medicaid representatives. And then if you want more information about the types of AT and services that are covered under Medicaid, you can go to michigan.gov and then also to apply for Medicaid, you can go to michigan.gov/mybridges. And I just want to spend one slide on private insurance because it's such a huge topic and there's so many variables involved. So private insurance may cover, private insurance plans may cover AT devices and services, but coverage may vary depending on the specific plan and the type of AT needed. So when you're determining coverage for AT, private insurance plans may consider some of the same factors as Medicare and Medicaid. They're going to look at medical necessity, the effectiveness of alternative treatments. They're going to look at the cost of the device. And then also some plans may have some limitations or exclusions on certain types of AT and devices and services. So, and then also if you have private insurance, you might want to see if there's an arbitration clause could limit your dispute resolution options. So if your insurance plans covers AT, you'll typically need a prescription order from your healthcare provider to obtain the device or service. So no matter what type of insurance you have, it's really important to get to know your insurance policy. So whether you have Medicare, Medicaid, private insurance, I just wanted these steps to help you might be helpful, sorry. So first step, review your insurance plan documents. Start by reviewing the documents. And these can be found on your insurance company's website. Look at the benefit summary, coverage policy, possibly a provider manual, such as with Medicaid. These documents will provide an overview of the types of AT devices and services that are covered. And also contact your insurance provider. If you have questions, give them a call. They can provide you lots of information about the types of AT devices and services they cover, and as well as any limitations or exclusions that they might have. Also, make sure you have your insurance card handy because they're probably going to want to know your member ID and your subscriber number. For pre-authorization requirements, and consult with your healthcare provider. I'm kind of running through these. I see that time is running short here, so I'm going to move on. So finally, I'm going to talk briefly about insurance denials and appeals. Unfortunately, denials are quite common when it comes to seeking payment for AT. Try to think of the denial as a request for more information. Don't assume that the insurance plan properly interpreted its own eligibility and coverage rules. Insurance denial and for AT and AT services can occur for a variety of reasons. Like I'd mentioned before, one of the major reasons you hear about is lack of medical necessity. Plans typically require AT devices and services be deemed medically necessary in order to be covered. If the company determines that the device or service isn't, it may not cover the product. So then excluded items. Insurance plans have specific exclusions for certain types of AT and services. For example, a plan may not cover AT devices used for recreational purposes, such as a specialized bicycle or wheelchair used for sports. Network providers, insurance plans have a network of providers, and if you receive your AT or services from providers not in that network, the insurance company may deny you coverage for that reason as well. Or documentation issues. Insurance plans require documentation from your healthcare provider, and sometimes some of that documentation is missing when you submit a claim. Excuse me. And then cost AT devices and services can be really expensive, and insurance plans might have limits on the coverage amounts they pay, or they might require cost sharing, such as copays or deductibles. If the cost of the device or service is deemed too high, the insurance company might deny it or require you to pay a higher amount out of pocket. And finally, I'm just going to cover appeals real quick, okay? I'd like to go over some general appeal tips. No matter what type of health insurance you have, these tips should be followed. First, review the denial notice. Insurance providers are required to provide a written notice of denial. Carefully review that denial notice and understand the reasons why your claim was denied. Look for any mistakes or inaccuracies in the decision, and gather any additional documents or information that you might need to support your claim. And also pay really careful attention to time limits, is typically the time limit that you're allowed to appeal within. Next, contact your healthcare provider. Reach out to your healthcare provider to ask their support in appealing to the decision. Your provider can also help you gather additional documents or provide a written statement supporting your need for the AT or AT services. I've even heard of some providers and suppliers who will actually file the appeal for you and represent you in the appeal. So if you get that offered to you, you're pretty lucky. File an appeal. So when you file an appeal, follow the procedures outlined by your insurance provider. This might involve submitting a written request or completing a specific form. Be sure to include all the relevant documentation and information to support your claim. And then be clear and be concise. In your appeal letter, be clear and concise in explaining why you believe the claim should be covered. Use specific examples, reference any medical documentation or other evidence that supports the case. And then be persistent. Don't give up if your appeal is denied. You may be able to file additional appeals or pursue other legal options. And finally, consider seeking outside help. If you're having difficulty navigating the appeals process, consider seeking some outside help. This could include working with a patient advocate, consulting with a healthcare attorney, or seeking support from a state or local disability services agency, such as DRM. Questions?
I do have one moment here. It says, let me get over there. Sarah, is it your opinion that the current Medicaid waivers would not cover technologies such as motion sensors, cameras for remote monitoring, tablets for communication with providers, and DCPs used in homes where individuals with disabilities live. She meant to say, is it your opinion? Yeah, I think that's what I said. So that's the question. I know that's very specific, but
Well, yeah, I mean, I can tell you that I'm not, I can't tell you all the things that the waiver programs will cover, but I can tell you that they will cover some things that are not covered by traditional Medicaid, or I know some of the, like my mom, she's on the My Choice waiver, and she could, under that Medicaid waiver, she could potentially get a ramp built because she's a wheelchair user, if we needed one. Fortunately, we already have one. But you know, there are different things that would be under those plans, but once again, it's very plan specific. So I never want to sit here and say you can or you cannot get something under a certain plan. Check the Medicaid provider manual. That's probably going to be your best source of information. And I don't have a link for that, but just do a search online, you know, Michigan Medicaid provider manual, and don't try to print it or download it. It's thousands and thousands of pages. So like I said, tell you chapter 12 covers medical supplies, and that's where I got a lot of my information for today.
I think the other thing to think about is that Sarah talked a lot in the beginning of that section about the Medicaid and medical necessity. What I explain to people, both from my experience and for others, is that, you know, building your medical records when you go to your physician, knowing that you need X or Y, it starts in advance with talking about the limitations and the things that are happening and getting that into your record also. So that's helpful, I think, to think about is where are you headed medically? What are you going to need and how do you get that documented? I just wanted to throw that in you. And
yeah,
that is all I see yet for questions here at this time.
that means either I really confuse people to where they don't know what to ask, or I did a good
If
job.
anybody has anything, it's a good time to jump in and put that in there. And then we'll continue through the end, and Sarah will answer the questions that come between now and then at the end of the presentation.
Oh, I'm done.
Okay, all right. Well, then let's take a minute here and give people an opportunity to ask questions either in the chat in Zoom, please, rather than the chat with captioning. If you would put it there or in the Q&A. Wait, I see one. All right, so here's a question. Are non-durable AT medical equipment ever covered?
I'm not sure how to answer that. Are you talking about Medicare or Medicaid?
Yeah, I think that's a tough one. I think that the idea of non-durable, you know, there are, as we know, there's assistive technology whose useful life due to just changes in electronics, it can be shorter term. I've seen those covered though, depending on what the person's situation is and what they're able to prove in terms of medical necessity. So, and then if for things that are not covered, that's when a program like Michigan Assistive Technology Loan Funds can look for funds, help to obtain funds, or talk to people about getting over to Disability Rights Michigan for what happens next if they're denied.
Right. And then also, what was I going to say? I lost my train of thought. I was listening to you, Tracy.
Let me just look through the chat real quick and make sure. So I guess we're still okay there.
Oh, I know what I was going to say. When she had mentioned durable, you know, as I had mentioned earlier in the Medicare presentation, or maybe it was the Medicaid, they'll cover associated, like related supplies. I wouldn't consider those durable medical equipment, but associated supplies like diabetic supplies, things like that.
I think too, as we talk about building the case for your medical needs, that's the piece that, you know, just to keep belaboring that, but I think encouraging both the folks you work with or for yourself, that you make sure when you are in any of those appointments that are relevant that you're making sure that that stuff gets documented. Just having been in that position myself, getting that documented is key. And then coverage from there.
And keep a copy of those documents. I mean, if you get an assessment done, keep a copy of it. I mean, it's harder on the back end to try to struggle to contact past medical providers to give you past notes, assessments, evaluations. Try to keep a copy of those, on file. All the times.
All right. Any other questions? Any other thoughts? Anybody have any questions about Disability Rights Michigan? Anything Sarah can answer as someone who's, I can say that my interactions with them have always been so positive, even back when they were by another name. So it's a great organization that serves people with disabilities here in Michigan and makes a tremendous difference in holding to account really the places that are required to provide services based on the contracts that they have. And that's very helpful for those of us who can't just go out and hire our own attorney.
Thanks, Tracy.
You're so welcome. Okay, I did get something come in. What would your advice be for someone who feels the walker she was supplied does not suit her needs and has not lasted long enough?
Well, I'd say follow up with your doctor, first of all. Can you get your doctor to write something to support that? And then putting in, I can't say the exact steps, but I mean, that's my initial thought would be to contact your provider, because they're not going to provide something or approve an AT device just because it's your preference. It's going to be what's medically necessary. So.
Now, for anyone who doesn't want to, who's not able to or doesn't want to type things in, if you raise your hand, I can make you able to speak and ask your question. So I've got another one in the open section. I'm going to read that one. And then if y'all will raise your hands, if you'd rather just ask your question without your camera, I'm happy to just give you options to ask verbally. All right. So the next question is, how can we be informed to know what questions to ask? Many times Medicaid case managers don't provide a lot of information, even when you're assigned an advocate. Are they just trying to save money?
Well, I mean, I did show you in the Medicaid that those two slides from the Medicaid manual. If you really want to know that, I mean, to provide anyone all that information up front is almost impossible. That manual is huge and it's very detailed. So I think, for you as a person insured by Medicaid, I would go so far as to go into the manual and start looking at the details of coverage. I mean, once again, it's really important to know your coverage up front before you even start to try to ask for what you need.
And also, don't forget that disability organizations that have existed for a very long time, I'm thinking about Judy's funeral yesterday, Centers for Independent Living, which here in Michigan, many are called Disability Network, are experts on having disabilities, living with disabilities, and advocating with disabilities for what they need. The Michigan Assistive Technology Program at Michigan Disability Rights Coalition is another way to get feisty. It's another way to ask questions about how do I advocate for myself? So there are organizations and individuals here in Michigan, including myself and Sarah and others, who work very hard to help people get what they need. So part of what a disability network might be able to do is hook a person up with someone else who has been through that fight, who can say, oh, here's what I found so very helpful. Here's how I went about the build to what I needed. Because there are those rules, right? I know I have people call me regularly whose wheelchairs worn out well in advance of how long it was supposed to last, or they've had changes in their medical needs and they need a different device. So those types of things where it's not within their regular rules, it can be really good to connect up with those folks also and see what you have to do to rattle some cages to get what you need, or your individual that you're serving if you're someone who serves people with disabilities. So I didn't mean to get so long-winded, Sarah.
No, I appreciate it. At least I'm not the only one talking now. And yeah, call our information referral advocates at DRM. I mean, they would be more than happy to help kind of talk through whatever your insurance issue is that you're having. And if it's not something they can help you to solve quickly over the phone, you might end up getting redirected to me, and I can dig in a little deeper and spend a little more time. I mean, one of the things that we'll often ask if someone calls about their, let's say they call and say, hey, I've been denied whatever device, under my insurance, first thing we're going to want to see is can you send me a copy of that denial? Because that denial letter is going to provide you with a lot of really key information in order to even begin thinking about filing an appeal. So it'll give you the reason for the denial, the dates, the timeline you have to follow to appeal. So if you can provide that to us along with, the questions about, what to do next, that's really helpful to help us guide you.
I think also that a lot of people that I speak to about the AT that they need and how to pay for it don't understand that they have appeal rights. I mean, the biggest part of this presentation that's so important for everybody to know is that just because you have public insurance, Medicare or Medicaid, does not mean that you are not a customer and that you do not have rights. And being the payer is not the determination of who has the rights. So talking to people about going back to whatever organization they've been denied, either Medicare or Medicaid, sometimes they've been denied something through mental health, or they've been denied something through some other provider. And it's important to know that you do have rights. You have rights also to ask for a different person. I tried this therapist. I didn't care for them. I'd like someone else. I tried this doctor. I'd like someone else. So those are things that are difficult to learn to self-advocate. And those are places that we talked about before, the disability networks, disability rights coalition, those kinds of places where they've learned how to advocate and how to help people to advocate. And also INR through Disability Rights Michigan, INR here at Michigan Assistive Technology Loan Program through Michigan United Cerebral Palsy also serve all disabilities and can help with questions and advocacy and how to reach out for help. I don't see any more questions, but I'm looking for hands up. Anyone want to ask something? Okay. Give it another minute. I know that it's a lot to absorb. Sarah, this content will be available, both the recording for today and Sarah will have her presentation up on her website. We will have this presentation up on our YouTube channel at MI-UCP YouTube. All right, here's a question. So this is an individual question. And what I would say is this might be better to go back to your particular provider. Well, I'll ask it and then Sarah, you can let us know. I need a new walker. My weight has changed due to my medical condition, but they say I can only have my CPAP machine or a walker every 5 years replaced.
What is the question though?
Yeah, I think that she's talking about the 5-year replacement period on both the CPAP machine and the walker. I would say, if the walker's not serving your needs, then to go back with a change of condition and talk to them about your medical needs having changed.
Absolutely, yeah.
A change of condition.
Yep, get that doctor on board with that. You're going to want the doctor to state as well that it doesn't meet your needs anymore.
So that's a good place to start. Well, I thank you all for your patience. Let me pull up my my notes here. So Sarah, thank you so much. I always learn a lot from you. I very much appreciate your taking the time to share all that great information with us. Thank you so much.
Thanks.
I'd love to invite you all to our next session. Chip Werner, Jeffrey Astring, and Gina Schaefer, a team of specialists from Disability Network Eastern Michigan, will present on increased audience via digital accessibility. They'll present on tools used to enhance equitable access to social media and digital documents. So that session will be available on Thursday, April 13th at 10 a.m. I will have worked out the captioning by then so that it appears hopefully the way that it used to, rather than having to go to that separate URL, but it will be available one way or the other. So please do plan to come and share that time with us to learn about digital accessibility. Have a great rest of your day. Thank you.
Thank you.